Hello, and welcome back to the American Academy of Research and Academics podcast, where we empower the next generation of researchers, clinicians, and academic leaders around the world. I'm your host, Sarah, and today we're diving into a powerful, practical topic that could be a game changer for medical students, IMGs, and residents alike. Why you should start working with national databases like the CDC, NHS, and more. Whether you're trying to strengthen your residency application, stand out for fellowships, or simply become a smarter, more impactful physician, this episode is for you. Let's get started. What are national database studies and why do they matter? So what exactly are national database studies? In simple terms, these are research studies that use large-scale, often government-sponsored data sets, such as CDC Wonder or NHANES National Health and Nutrition Examination Survey, NHS Digital from the UK, SEER Database for Cancer-Related Data, HCUP, Healthcare Cost and Utilization Project, and others like the National Inpatient Sample, NIS. These databases include millions of patient records, lab results, public health trends, hospitalization data, and more. They are real-world, population-level goldmines of information. So instead of interviewing 50 patients, you're analyzing data from 50 million. Why does that matter? Because in a world driven by evidence, scale equals credibility, and national data sets give you that scale. How this helps in the residency match. Here's the truth, the U.S. residency match is fiercely competitive. You're not just applying with your USMLE scores, you're presenting your entire narrative. A research project using the CDC or NHS data says several things about you. You understand epidemiology and public health. You know how to handle real-world clinical data. You care about population health, not just individual cases. And most importantly, you can generate evidence-based insights that matter to the U.S. healthcare system. Programs love to see that. It shows maturity, independence, and relevance. Especially for IMGs, national database publications can help overcome geographic or institutional bias. You don't need to be at Harvard to publish a study using CDC data. You just need curiosity, access, and mentorship. Why it also matters after you match, fellowship and beyond. Now let's talk long-term. Once you've matched, your next challenge might be fellowship. Whether it's cardiology, hematology, oncology, GI, or pulmonary critical care, they all expect research. And guess what? Many fellows build their research portfolios using the same tools: NIS, NRD, NEDS, SEER, and CDC datasets. Doing this early in your journey gives you a competitive edge. You're already skilled in dataset navigation, you understand statistical methodology, and you've already published something meaningful. Fellowship directors take note of that. Not only that, many of these studies have policy implications. Your work could be referenced in guidelines, health equity papers, and policy briefs. That's impact. Becoming a better physician through data. And even if you're not chasing publications or fellowships, let's talk about clinical benefit. Understanding trends in national data makes you a better diagnostician, a better counselor, a better leader. If you know that obesity in a certain population is rising, you screen smarter. If you see disparities in cancer survival rates, you become more aware of biases. If you've analyzed opioid prescribing trends, you practice more responsibly. Medicine is not just one-on-one anymore. It's systems level, and national datasets help you see the system. How to get started, even without a PhD. So here's the practical part. How do you get started? 1. Pick a mentor or platform. Join organizations like ours, the American Academy of Research and Academics. We offer research mentorship using real CDC, NHS, and other datasets. 2. Choose a question, something broad yet answerable. Example: what's the trend in stroke readmissions in young adults over the last decade? 3. Access the data. CDC Wonder, SEER, and NIS offer open access portals or data use agreements. 4. Use tools like SPSS, R, or Stata, and we'll teach you how if you're not comfortable yet. 5. Write, revise, publish, and yes, submit to real journals, not just posters. We'll support you every step of the way. You don't need to be in a lab. You don't need NIH funding. You just need intense support and consistency. Final thoughts and call to action. Let's wrap this up. National database research is not just for statisticians and professors. It's for the medical student trying to get interviews, the IMG aiming for a fair chance, the resident building a fellowship CV, and the physician who wants to be a true healer at scale. So what's stopping you? If you're ready to start, we're here to help. Visit airacademics.com, connect with us on LinkedIn or Instagram, and let's turn your research goals into published reality. Until next time, you've been listening to the American Academy of Research and Academics podcast. Stay curious, stay committed, and keep publishing. See you in the next episode.